debate. I recognize the member from Kenora-Rainy River.
Thank you, Speaker. It is an honour to rise and speak on this private member's motion introduced by the member from Simcoe Grey. I would like to start by saying that I agree with the intent of this motion, that is to eliminate the wait list for long-term care services, but I have to say that this motion is too limited in its application by only seeking to eliminate the wait list in the counties of Simcoe and Grey. I know that the member is just trying to represent his constituents, and there is honour in that, but there is need for more long-term care beds all across this province. And because all of our long-term care beds are at crisis levels. I had hoped to see more leadership and vision from the PC party on this issue by calling for the funding of more beds right across the province to eliminate the wait list for all people in need of this care. The fact is that as of March of this year, there are more than 30,000 people who are on a wait list for long-term care in the province of Ontario. Wait times for people who urgently need long-term care and are waiting in hospital have increased 270% since the Liberals came to office, from a median of 18 days to 68 days. This is just a median. In northwestern Ontario, and Kenora-Rainy River in particular, the wait times for 9 of every 10 people who are waiting for this service can be as long as 1,402 days for a basic bed in Sioux Lookout. For those of you who are doing the math, that is nearly 4 years. That means 4 years of being stuck in a hospital without the necessary supports to provide the specialized care our seniors deserve, and families worrying about the safety of their loved ones. It also means that many seniors in the Northwest will not be able to even see the inside of the long-term care unit because they will never make the cut. It leaves families who can afford it to try to privately fund some supplementary hospital services, such as those of a personal support worker, for a few hours a day to make sure that the needs of their loved ones are met, even if just for those few hours. It also means that loved ones who are in desperate need of greater supports and supervision and who are lucky enough to get a long-term care bed are forced out of their home communities into other centres hundreds of kilometres away and without the personal and emotional supports they need at a time when they need it the most. In the far north of my riding, it is not uncommon for people to be sent out of their remote First Nation community to Sioux Lookout. But because of Sioux Lookout only having 20 beds to service a catchment area of 30,000, these people are then sent out even further to places like Dryden or Fort Frances, where their loved ones cannot easily visit with them, and where these facilities don't always have the ability to speak their language. The resulting poor health outcomes are painfully evident. All seniors in the Sioux Lookout region and right across Northwest Ontario are left suffering due to a profound lack of beds. One woman, Christine Sanders, wrote to me a few months back, very persuasively articulating her mother's struggle to access a long-term care bed in Sioux Lookout. I asked her if I could share her story here today with us, and I'm very pleased that she agreed because it's very poignant. She writes, "My mother has lived in Sioux Lookout since 1949. Both she and my father were always big community boosters. They took pride in their town and contributed to it, trying to make it a better place. As a child, I remember my mother lamenting the fact that elderly people had no choice but to go to Kenora or even further afield for long-term care, as there is no such facility in Sioux Lookout. Quote, it's just not right that they be sent away from their community at this stage in their lives. Not surprisingly, my mother became involved with SLICO, Sioux Lookout Extended Care Organization, a group spearheaded by the Legion and especially Rachel and Bill George. This group began agitating for a nursing care home in Sioux Lookout, and in 1991, after over years of putting pressure on governments and local fundraising efforts, the William A. George Extended Care Facility opened. Initially, it could only accommodate 20 residents, but a further 60 beds were promised. And yet, as the years went by, the demand for nursing care in Sioux Lookout increased dramatically, but these beds never materialized. Now at 93, my mother suffers from dementia and limited mobility. Since February, when it was determined that she would be unable to manage safely any longer in Sioux Towers, she has been warehoused in the hospital, along with many other seniors in the same position. She now has been on a wait list for long-term care for over a year and is 19 of 20 on that list. Care in the hospital is inadequate for her needs. Nursing staff do their best, but they have neither the time nor the specialized training to deal with elderly dementia patients. Nor do they have enough adapted equipment for the elderly, things like bed alarms or reclining chairs. Our family is in the fortunate position of being able to pay privately for a PSW to provide personal care to my mother during part of the day, but what happens at night when she is wakeful and restless? And what about those families whose means don't stretch to that? I urge both the provincial and federal governments to address this issue, to put money into this immediately and to provide the beds that Canadian elders like my mother deserve. Aside from the humanitarian issue, this stopgap measure of leaving elders to languish in the hospital is a very expensive model. Nobody wants to end their days in a nursing home, but we don't always get to choose. And I have come to realize that a nursing home would be a blessing for my mother compared to this. And we're all aging. We'll be there soon, too. Sadly, Christine's mother passed away before she was ever able to see her dream of more long-term care beds in Sioux Lookout come to fruition. She died in hospital, like so many others, without ever receiving the proper care she deserves. As mentioned, there is a clear demonstrated need for additional long-term care beds in Sioux Lookout. As of a couple of years ago, it was estimated that there were more than 40 people in need of long-term care who were relocated to Thunder Bay due to a shortage of beds in Sioux Lookout. After Thunder Bay, Sioux Lookout is the largest sub-area of the Northwest LHIN, with a catchment area of, as I said, more than 30,000. And it is uniquely prepared to provide culturally appropriate care to Indigenous populations. Sioux Lookout's Menoyawan Hospital was even designed with the ability to accommodate more long-term care beds in mind. Speaker, the need for more long-term care beds in Sioux Lookout is well documented. The community is well positioned to provide an increase in culturally appropriate long-term care. In fact, there is a current proposal for an additional 76 beds in a building adjacent to the Menoyawan Health Centre that has the support of the Northwest LHIN, but has been sitting with the ministry since July 2014 with no response from the government. There is a demonstrated need for an additional or an immediate investment in long-term care all across this province, and our seniors cannot afford to wait. Ontarians from all across this province are pleading with this government to please act now. Invest in long-term care so we can address the deficit and meet future needs. Thank you.
Give further debate.